IV fluids are a cornerstone of clinical care. Understanding them is vital. Let's dive into the three main categories. First, isotonic fluids. These have the same solute concentration as blood, meaning there is no net water movement in or out of cells. Because they stay in the extracellular space, their primary function is to expand blood volume and maintain circulation. Clinically, we use isotonic fluids to treat hypovolemia from fluid loss, dehydration, or shock. The most common examples are 0.9% normal saline and lactated ringers. 5% dextrose in water, or D5W, is a special case. It starts isotonic, but once the glucose is metabolized, it becomes hypotonic. Next, hypotonic fluids. These have a lower solute concentration than blood, causing water to move into the cells. Their main function is to hydrate the cells and increase intracellular fluid. Common types include 0.45% normal saline, often called half-normal saline, as well as 0.33 and 0.225% NS. These are used for cellular dehydration and hypernatremia, where sodium levels are too high. However, they carry risks. They can cause cell swelling and bursting, known as lysis, and may lead to low blood pressure. Now for hypertonic fluids. These have a higher solute concentration than blood, pulling water out of the cells and into the bloodstream. They are designed to pull fluid out of tissues to reduce edema and expand the vascular space. Examples include concentrated salt solutions like 3% or 5% sodium chloride. Dextrose combinations like D5NS, D5-half-NS, and D10W are also hypertonic. Clinically, they treat cerebral edema, severe hyponatremia, and shock by pulling fluid into circulation. Risks include cell shrinkage or crenation, and the potential for fluid overload in the bloodstream. There is also a special category called colloids, or plasma expanders. These contain large molecules that stay in the bloodstream. They use oncotic pressure to pull water into the vessels, rapidly increasing intravascular volume. Common examples include albumin, dextran, and hetastarc. They are critical for treating hypovolemic shock, severe burns, and low protein levels. Remember, colloids hold fluid in the blood, whereas crystalloids can move more freely. To compare quickly, isotonic fluids result in no movement and normal cells. Hypotonic fluids move into the cell, causing it to swell. Hypertonic fluids move water out, causing cells to shrink. Colloids pull fluid into the bloodstream with no direct cell effect. Let's use simple NClEX logic to remember this. Isotonic stays in the vessels for volume. Hypotonic pushes water into the cells to swell them. Hypertonic pulls water out of cells to shrink them. Colloids pull fluid into the blood for strong expansion. Critical tips: always check sodium levels and monitor fluid balance for edema or dehydration. Never give hypotonic fluids in head injuries as it worsens brain swelling. Use hypertonic fluids carefully to avoid overload. Stay informed, stay safe.